Come in.
Hi, my name's Megan. I'm a Clemson nursing student. I'll be doing your assessment today.
Okay.
Okay, I'm gonna go wash my hands really quick. How are you doing today?
I'm doing good, thank you. How about you?
Good. Alright. Can you tell me your name and date of birth?
My name's Emma Hardigan. My date of birth is 1/24/2000.
Okay, perfect. Thank you. I'm gonna pull this curtain to provide us some privacy.
Okay.
Perfect. And then I'll be taking your vital signs and doing an abdominal assessment today. I'm going to be speaking out loud because I'm doing it for my instructor. If you have any questions or concerns along the way, just let me know.
Okay.
Ms. Hardigan, can you tell me where you are right now?
I'm at the doctor's office right now.
Okay, and do you know why you're here?
I'm here for my annual physical.
Okay, and do you know what day it is?
Today's October 13th, 2020.
Okay, perfect. So Ms. Hardigan is awake, alert, and oriented to person, place, time, and situation. Her speech is clear, coherent, and reality-based. All right, Ms. Hardigan, now I'm going to be checking your vital signs. I'm going to start out with your radial pulse. Okay. So I'm going to check for her radial pulse for 30 seconds if it is regular and multiply that by 2. If it's irregular, I'm going to count for a full minute. For the first 30 seconds, I'll be listening to her radial pulse. For the last 30 seconds, I'll actually be checking for respiration rates, but not telling her, so she doesn't alter her breathing. Okay. So for your radial pulse, I got 68, and for your respirations, I got 15. Okay, now I'm going to take your temperature. Perfect. So her oral temperature is 97.3, which is also in normal range. Now I'm going to take your blood pressure.
Okay.
All right. I'm going to find her brachial artery. All right. Now once I found that, I'm going to line up the arrows on the blood pressure cuff with that brachial artery. Okay, perfect. Okay, so I'm gonna feel her radial pulse and inflate the cuff until the radial pulse goes away. All right, so her radial pulse went away at 140. So I'm gonna add 30 to that so I know what to inflate the cuff to when I'm taking her blood pressure. Now I'm gonna take your blood pressure. All right. So I'm inflating the cuff to 170. And then I'm slowly releasing the air until I hear the first systolic sound. Which I heard at 115, and now I'm listening until the sound stops for the diastolic sound. Which I heard at 70. So Emma has a blood pressure of 115/70. Which is normal and in range. Are you in any pain at all?
No, I'm not.
Okay, and if you had to rate any pain, it would be a scale of 0 being no pain and 10 being excruciating pain. Where would you rate it?
I'd put it at 0.
0? Okay, perfect. So Emma reports no signs of pain. All her vital signs are normal and within range. Now we'll be moving on to the abdominal assessment. Okay, Ms. Hardigan, now I'm going to be doing your abdominal assessment, if that's okay?
Okay.
Perfect. Have you ever had any abdominal problems or a history of GI problems?
No.
No? All right. So I'm going to inspect first, but after I inspect, I'm going to auscultate before I palpate so I don't mess up any bowel sounds. It'll be there. Okay, so first we're going to start with inspection. If I can lift your shirt up. Perfect. So as I'm looking at the abdomen, I want to look for any distension or protrusion, which I do not see. I see a flat abdomen, which is a normal finding. Umbilicus is inverted, which is also normal. So now I'm going to be auscultating. I'm going to listen in all 4 quadrants and see what I hear. Okay. I'm going to be listening for a full minute in each quadrant, starting with the right lower quadrant. So I heard active sounds in all 4 quadrants, which is a normal finding. If the sounds were absent, that means that I would have to listen for a full 5 minutes just to make sure that I wasn't missing anything. If they were hyperactive, it'd be almost a constant sound. And if they were hypoactive, it would be less than 5 sounds per minute. Okay, so then we're gonna move on to percussion. So when I percuss, I'm gonna put my left hand in multiple different places on the abdomen and tap my finger and see what kind of sounds I hear. Okay, so I heard tympany, which is a normal finding over the abdomen. Perfect. So now I'm going to do blunt percussion, which is going to be on your back to check for any kidney infections. So I'm going to find the costovertebral angle, which is going to be where the angle where the 12th rib and the spine meet. Find that. Okay, and then I'm going to place my left hand flat on her back and strike it. Did you feel any pain?
No.
No? Okay, and then I'm going to do the same on the other side. Did you feel any pain?
No.
Okay, perfect. So if she felt any pain or tenderness, we would have known that you would have something like a kidney infection going on. Okay, now I'm going to be doing light and deep palpation. Just lift your shirt up. The light palpation, I'm just going to go 1 to 2 centimeters, see if I feel any abnormal enlargements or anything like that. If you feel any tenderness, let me know. Okay, did you feel any tenderness?
No.
Okay, perfect. Now I'm going to do deep palpation, which is going to be using both hands to check for any masses or anything like that, enlargements. If you feel any tenderness, again, let me know. So this one I'm going a little bit deeper. All right, any tenderness or pain?
No.
Okay, perfect. So sounds good. So everything looks good and normal, and that's the end of your abdominal assessment. Thank you.